We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and U.S. governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself.
Wonderful. Thank you, Mary. So again, welcome everyone. We have started recording. Again, my name is Catherine Harrison. I use she, her pronouns. I am a member at large and team lead for the voting and health work here at Minnesota Public Health Association. And we're so excited today to have our partners from Healthy Democracy, Healthy People, as well as the We Choose Us coalition campaign to talk about building really fundamental skills for engaging policymakers and advocacy in the context of voting and health. So with that, I'm going to go ahead and turn it over to Nora. For Nora and all of our speakers today, if you can just give a quick introduction on your name, including your pronouns, that would be great. Thank you.
All right. Hi, everyone. My name is Nora Moss. I'm the Partnerships Director of Healthy Democracy, Healthy People. I use she, her pronouns. And I've been working with our Minnesota coalition to really think through how public health and health professionals can come together to support an inclusive and representative democracy within the state. I am just here to talk a little bit about the evidence and the relationship and what we know about health and democracy, but to introduce our coalition. At the national level, Healthy Democracy, Healthy People is made up of 11 national public health organizations that came together in 2020 with an aspirational narrative that our health and the health of our communities are directly tied to voting. And so we need to show up and vote in every election up and down the ballot to really assure the conditions necessary for health. And we continue to do work organizing narrative, people, and policies to really assure the conditions of a healthy, robust, representative democracy for all. So what do we know about the relationship between health and voting? So first, I want to draw on a few historical examples. We know across history that when people have organized and exercised their right to vote, we've seen advancements in health and racial equity all throughout time, starting from the end of the Civil War, when Black voters were registered and mobilized to support policies like community investments in medical services, down to, even as soon as in 2010, we saw organizers really mobilize voters and bring about the passage of the Affordable Care Act, and then organize at the state level to expand access to Medicaid coverage, which really brought health access to a much needed part of our community. But all of these examples on this slide have come with contested, continuous struggle for power. And so it hasn't been as clean cut as when we vote, everything gets better. We've also had many examples of restricting the electorate, and that has also been shown to be related to health inequities and steps backwards. But from the scientific literature, there's a growing body of evidence showing that there's a consistent association between voter participation and civic participation and health outcomes. People who vote tend to be healthier than people that don't vote. We at Healthy Democracy, Healthy People helped put together the Health and Democracy Index, and we know that the states and counties that have more voter restrictions are associated with better health outcomes. And also there's recent literature showing higher COVID case and mortality rates in US counties, and that this relationship is really stable across time, that state level voting policies have been shown to be associated with our overall state health outcomes between 1996 and 2020 across all presidential election years. And so the bottom line is really that state policies that support robust participatory democracy and voter participation itself have been shown to be associated with health outcomes really across the board. And that has brought forth our understanding that health and democracy are interdependent, that we need to have power to influence the systems and policies. That leads to our better health outcomes. Communities that vote at higher rates tend to be healthier and have that power to influence. So we have a continuous virtuous cycle in this relationship between health and democracy. We've measured voter participation through or access to voting through the use of the cost of voting index. I'm not going to go too deep into the cost of voting index, but it does rank states from the easiest state to vote in to the hardest state to vote in. And Minnesota, until very recently, was right kind of in the middle of the cost of voting index rank. And we've used this tool, the cost of voting index, to compare across 12 different public health indicators. And what we found is that when communities vote, they influence the policy decisions that have a big effect on their health. And just to show this very clear linear relationship, you can see on the x-axis that cost of voting index rank, where states with less voting access are on the left side, states with more voting access are on the right side. And then we can see almost a linear relationship between overall state health, where the y-axis is better health on the top and worse health on the bottom. If you want to take a deeper look at the index, you can go and sort by the different health outcomes on our website. Here's just a sampling of a few, and you can see how the relationship stays consistent across the measures. And then you can also sort by the policies and the cost of voting index. And you can see how the different states at varying parts of the graph light up depending on what policy we're looking at, and really drives home that this relationship is pretty consistent across the board. And then if you're really interested in more data, there's a data table that you can look at on the Health and Democracy Index website, and you can sort by all of the different measures, including the policies, and look at specific states more in depth. And so I don't know why that slide is there, so I'm going to stop sharing and pass it over to Lily, who's going to talk more about We Choose Us and how we've come together in Minnesota and what we're doing here today.
Thank you so much, Nora. My name is Lily Thassey, she, her, hers. I'm the director of We Choose Us, and we are a campaign and coalition of over 40 organizations in the state of Minnesota. Those organizations range from coalitions in and of themselves, like Healthy Democracy, Healthy People, to grassroots organizations and unions and other community-based organizations who are all working to build a thriving, inclusive, multiracial democracy in the state of Minnesota. And all of our partners have come together across issue area with the priority to make sure that we have a democracy that represents us, that we experience power and agency in, and that includes everyone who calls Minnesota home. And as Nora was mentioning about the progress that we've made in Minnesota, last legislative session, our main priority was focused on increasing, expanding, and protecting a lot of our voting rights and voter access laws that we have in Minnesota. And I think I read a Politico article recently that said that we were now either #1 or in the top 3 in the nation in terms of voter access laws. So huge win for us. We're the biggest set of pro-democracy reforms we've seen in the last 50 years last session. And so we were trending in the right direction when it comes to democracy. And when we built We Choose Us, we set out with this general analysis that in order to meet the moment and make sure that we were not only just talking about protecting our democracy, but also expanding access to it, we needed to be really rooted and grounded in organizing and in community and in people who were experiencing democracy, or frankly lack thereof for some, every day. So we intentionally built with all of these coalition partners, many of whom do community organizing, to build our advocacy efforts and get to the place that we were able to get in the last legislative session. We work on a variety of other things, not just policy, but that is a big part of our work. So is communications and narrative building. So it was organizing and power building in communities. And then also too, we've done a little bit of more electoral work through a different organization still affiliated with We Choose Us Action. So to give you a bit of a sense of for the timeline of We Choose Us and what we're going to be talking about today, which is research visits, which is an advocacy tool for us to be able to build out advocacy efforts, but also just get a general lay of the land when it comes to our topic of interest. So we at We Choose Us, I'm going to share my screen. Oops. Always get those buttons confused. Okay, so we started building before even launching, but started building January of 2021 and didn't emerge out of nowhere. There was a lot of organizing that happened before we built our campaign and coalition, and with those partners who had been organizing in the space for a long time, came together to build a broader coalition, which is more powerful in numbers, and we're all working together. There's a lot of building, and I'm not going to go through each one of these different points, but feel free to read for yourselves. A lot of building, a lot of what I would consider even research visits, one-to-one conversations with stakeholders, so organizations themselves, not with decision makers, but with people who had been in the space or maybe had an interest in working on democracy or was part of their mission. And so got to sit and listen and learn and have a lot of conversations with people about what was needed in Minnesota, which eventually led us to refining our coalition and structure and officially launching our work in June of 2022. A lot of it was rooted in community, building with folks, building awareness about our campaign, having listening sessions, combating mis and disinformation, a lot of listening again, absorbing, enrolling people into a path to protect and expand our democracy, which eventually culminated in a strategy retreat that launched our work in 2023. Like I mentioned, we're focused a lot on the legislative session last year, but this thing was happening at the county level in the fall where we were noticing some anti-democracy organizing at the county level. And in that, because we didn't just want to make bold assumptions about what was happening, but launched a set of research visits, which again, we'll be talking about a little bit more in depth later on. But to really sit down with the county commissioners and the elections officials and ask them, what are we seeing in this county? How can we protect our democracy? We've noticed some things in the news. We've seen some things happening at county board meetings. How do we be honest about what's happening here and come together to think about ways that we can not only protect, but also expand our democracy, not just at the state legislature, but also at the county. So that was the start of our research visit path. I will say, we weren't necessarily expecting to have such a ripe opportunity to pass the pro-democracy reforms we did last session. So a lot of our work then became focused on the legislature. However, this year, we have now started building again for our path in 2024. And because we had so many amazing wins, we are now more seriously thinking about what is our next step. We know we want to do some stuff at the legislature, but this county path, these research visits, this advocacy work that offered an opportunity to bring more people into the conversation at the county level, and then also to do some really transformative changes, policy changes at the county level. How do we build that out? And so we've been working on a legislative agenda, but we're really exploring scaling up these research visits. And I will stop sharing my screen and just mention, so we have a couple folks here today from the Washington County Democracy team. This team has been doing research visits all around the issue of protecting and expanding our democracy in Washington County, which they can speak a little bit more about, what places does that include? Maybe you live in Washington County. But they have been meeting with county commissioners primarily to build those relationships, have conversations, better understand what can we go do to protect and expand our democracy in Washington County. What history of anti-democracy attacks have we seen? and then build out a strategy accordingly. So I'm going to turn it over to Sandra and Martha to share a little bit more about what that experience has been like for them in Washington County.
Yeah, hello everyone. Good morning. I am Sandra Larson. I am here today in my role as part of the Washington County Democracy team. And I just wanted to thank you for inviting us to share our experiences. It's been an interesting process, and I really want to underscore that it's not a hard process, but super rewarding. Like many of us, we were sort of shell-shocked after January 6th and thinking about, clearly democracy needs some care and feeding here. And so we started thinking about what could we do, as democracy champions to kind of advance this idea of expanding and protecting democracy. And when Lily suggested this idea of the county teams, which really was so perfect for us because we also want to work at the local level. And so it just brought those two ideas together, and that Martha and I just said, oh, let's go for this. And it has been really a wonderful experience. We started just trying to build that team, which ended up being pretty easy. There were lots of folks, that were thinking exactly as we were. We're now a coalition of county residents who are members of the League of Women Voters in Minnesota, and also are two of our local League of Women Voters groups, Clean Elections Minnesota, and then Martha and I, who are with St. Croix Valley Indivisible. We're on the leadership team of that indivisible group. So I decided to talk about, probably the boring and obvious part of this process, which is the planning and the steps we went through to start thinking about our research visits. Why did we decide to do this? And it really was, as we got together, all these people from Washington County, kind of across the county, we have pretty good geographic representation. We said, geez, we don't really know much about the landscape in which we're working. And we were hearing reports in the news about, all of these things that Lily just talked about, poll worker intimidation. People, are resisting the idea of ballot drop boxes and worse, real intimidation of people as they were dropping off their ballots. And so, we were just really asking ourselves, is this happening in Washington County? What's going on? And, we just didn't have the answers to that. And so we thought an excellent place to start would be to talk to our county commissioners, who, after all, oversee the administration of our elections and have, ultimately quite a lot of control over what happens, following up on that, whole idea that this is where the people and the voting comes together. And so we just said, well, let's embark on this. We have 5 county commissioners in Washington County, and we just decided to go talk to them, as Lily suggested. And so couple of reasons that we wanted to do that was we just wanted to understand, you know, what's happening or, you know, not happening in our county, but also thinking about the future and establishing a good trusting relationship with our commissioners so that if these things cropped up, they might let us know about them and give us an opportunity to take action. So the things we did are the things that any one of you would do. We sat down and we said, well, you know, why are we going to do this? How are we going to do it, etc. And Lily provided us with a toolkit that we used a lot to kind of provide the guidance and centering. We also have a lot of League of Women voter people on our membership, and you know they know how to talk to candidates, legislators, and so they very much grounded us in that planning process. You know, first the whole group talked about, well, shall we do this? You know, why would we do it? Really thinking about that purpose and thinking about, you know, what are our questions? What do we want to know about our county? And so as we thought about those visits to each county commissioner, we felt that it was important that we would make sure we had constituents at those meetings, as well as some members from our group. We talked about the questions, how much time we would be able to ask for, and decided that we would ask for 30 minutes and then try to fit those, you know, the questions into that time frame. You know, we talked about how we want to approach the tone and the, you know, kind of the feel of these meetings, and we all agreed that we wanted to be friendly and supportive, curious, you know, and really hope that we could kind of co-participate in advancing democracy in our county. So we broke into small groups at that point, you know, or a group for each, you know, that was planning to attend each county meeting, research visit with county commissioners. We, as a small group, just decided on our agenda, you know, talked about, do we have the constituents we want here, and in some cases recruited additional people to attend the meetings. We decided it was going to send out the letter, and you know, what the letter was going to say, and what we wanted the tone of that letter to be, you know, explaining our purpose, etc. We established, you know, almost like a script for our meeting, who was going to introduce the meeting, who was going to, you know, wrap up the meeting, what questions we felt we could work in the time frame we were given, who's going to ask the questions, and you know, how we would all participate in the discussion, which really you know, worked out very well. We just had someone ask a question, and then and everyone else kind of pitched in and filled out the question, listened to answers, and really tried to get our commissioners talking about, you know, comfortable talking about what their constituents were saying. Were there any you know, issues? Had they heard much from their constituents about concerns about voting, etc. And after the meeting, we just decided to get together and debrief, which was interesting and fun. We just got together at a coffee shop and talked about how we felt about the meeting, what we learned and whatnot. Oh, and something I didn't mention is we had someone take notes too during the meeting. So we had information to share back with our members. And, of course, we wrote thank you notes. So, sounds like any meeting that you would do with someone that you wanted to learn something from and develop a relationship. And so, just not hard, a no-brainer kind of thing. We sent our thank you notes. We went back to our large groups, our larger group, and shared kind of how the meeting went and what we learned, what we didn't learn, how guarded that particular commissioner was, and how open that particular commissioner was. And I thought it to be a really great experience, not particularly difficult, and we felt we not only learned some things about our county, but learned, which of these county commissioners we kind of expect to go back to if we had additional questions, who would be the best information source. So I'm going to turn it over to Martha. She is just
Sandra, we're losing you. Okay, we've lost Sandra. She's frozen, so I'm just going to start talking. So anyway, I'm Martha Winslow, and I too am a part of the St. Croix Valley Indivisible group and a part of the leadership team. And the St. Croix Valley Indivisible group has been connected with the We Choose Us group and Lily since that December 22 strategy session that she talked about. And so we went through the legislative session with her, and then it was after that that she introduced this idea of county teams. And as Sandra said, Sandra and I were like, well, yeah, we're in on that. That sounds like something we really want to do in our neighborhood. So we got, our Indivisible group is really interested in being really quite hyper local and keeping our focus on what's going on locally and our activism around what's going on locally. So anyway, that's my connection with this county team. So Sanders talked about the process and the plans we made, and the fact that we had, I don't know, there were 6 or 8 of us together that started this whole process. And so what I want to do is just sort of add a little more color to that by talking a bit more, sort of telling some stories about sort of how it went. So she told you the process. So let me tell you a little bit about how it went. So I think one really good example is a meeting that both Sandra and I were in. And she described how, we had this letter that we sent out. So these letters were sent individually. There are 5 commissioners in Washington County. So Sandra simultaneously, I think, sent this letter via email to 2 of the commissioners because we were ready to get started. Well, it turns out that these 2 commissioners seem to share an administrative person. And this woman quickly realized that both these commissioners had received the same letter, and somehow they all started talking amongst themselves. So she came back to us and she said, well, so would you be willing to meet with both these commissioners together? Well, that wasn't really our idea, because we thought if we could meet with one commissioner and we only have 30 minutes, we'd get more information, more of a feel for who they were and what they were like and all that kind of stuff. But, if you get offered a meeting and they want to say there's going to be 2 of us there, you just say yes. So we did. We just said yes. So we went to the meeting. We weren't sure what we were going to expect. At least I wasn't sure what we were going to expect. And what was interesting is we went to the Washington County Government Center, got ushered in up to the 5th floor, a nice meeting room. And not only were there 2 commissioners there were 2 staff people. And I thought, okay, these people have come really armed, not knowing who we are and what our approach is and all of that kind of stuff. And so we all sat down and we weren't quite sure what to expect. We went through our process. You know, we described who we were, that we were nonpartisan, that we were there for information, that we were, you know, dedicated to the idea of voter access and democracy. We went through our questions and they kind of warmed up to us, and they started telling stories, and they had given us, I can't remember, it was 20 minutes or 30 minutes, but it was a small amount of time with 4 people in the room and all our questions. And it went really well. And they ended up allowing us to say, we probably talked for 45 minutes before we left. And at that point, I was feeling really badly because we'd taken so much of our time, but they, you know, they warmed up and they told us stories. And so it really did go well. And as we were leaving, we were saying to each other, both the commissioners as well as our group, we want to continue this relationship. You know, we'll be back in touch. And one of the staff people that was there is a person who is in the sort of elections division, if you will, for Washington County. And she invited us to come to a meeting that was happening in a couple of weeks for the testing of the elections equipment. So, you know, it sort of ended really well. So I just want to say, you know, I think sort of to tell that story is to tell the story that you don't always know how it's going to go, but you can make the process work, and you can begin that, you can really begin that relationship. So as we debriefed, we did go, as Sandra said, we went to a really nice little coffee shop that's not very far from the Washington County government building, had coffee, had a nice pastry, talked to each other. And I think what we said to ourselves is, we got some really good information. We got reassured there isn't a lot of bad stuff happening in Washington County around voting access, but there's, you know, the commissioners are watchful just like we are. The other thing is, they told us stories about what they do and what their jobs are and what they enjoy doing. Both these guys have been doing this as commissioners for a really long time. And at the same time that we felt like they brought us into their world, we also realized they were just a little bit guarded. You know, this was only the first time they got us, but we'd made a good start. So anyway, you know, I think we felt like we had accomplished what we wanted to accomplish, but we also knew we weren't going to get everything. We knew we hadn't gotten just the full opening of their hearts. So anyway, I tell that story too, because if you go in and you talk to someone and you feel like, well, maybe they're a little reticent, you know, it's just natural. It just takes some time to build a relationship with these elected officials. So that's one story. So there are 5 commissioners in Washington County, because we had the one that doubled up. We had 4 meetings. Another example of a meeting was another one that both Sandra and I went to. And this commissioner, we sent the letter to, and we didn't hear from him, and we didn't hear from him, and we didn't hear from him. And you eventually think you're just not going to hear that, he's just ghosted you. Well, it turns out he eventually gets back to us. And in fact, he'd had some health issues. So he'd just like been out of the office for a month or a month and a half. So, and he hadn't been responding to email. And when he got back, yeah, he was willing to have a meeting with us. And he was interesting because he took to heart the fact that we were connected with We Choose Us, and we wanted to talk about democracy. And he'd done his homework about the bills that had passed in the last legislative session. And he had his little piece of paper, and he could quote chapter and verse. And so, I mean, it's just sort of interesting how each of these meetings go. And you just can't make any assumptions. You just got to work with these elected officials as they are. There were 2 other meetings, and they were much more informal. I think the informality just had to do with who those 2 commissioners were, maybe their age, the longevity in their offices. They were more informal. Neither of them were in the Washington County Government Center. They were held at a restaurant. But it's the same sort of thing. I had the feeling that as those groups told their stories, is that these 2 commissioners went in and they knew what stories they were going to tell to this group, and they knew where they were going to hold the line. But again, both those groups felt like they had started the process of building the relationship and gotten information that they wanted.
Martha and Sandra, I want to thank you. I'm gonna redirect us back to Lily a bit because we
Okay.
want to start with the stories to kind of give folks the flavor and the feeling of what this looks like. And then
Okay, I
Lily's
was just gonna close. Thank you.
yeah, well, thank you. And so Lily, I'll turn it back to you to kind of break it down for us a little bit more on process. And then there may be a time where we'll ask you, Sandra and Martha, to bring back some more of those stories in the question and discussion time. Thank you.
Awesome. Thank you. Well, you heard Sandra talk a bit about the process. So I'm going to share a bit about that too, but I think Martha's stories really hammered home. There are so many different advocacy options. I think a lot of, what we default to is maybe visits with our legislators where we're telling them about an issue that we care about and hope that they take action on it. Or we send a letter or make a phone call or send an email. And all of those are really great tools to advocate for something that you care about. Research visits are another way to become an architect, if you will, in building out a strategy to advocate for the issue that you care about. So it's building those relationships, as you heard, walking away with information that allows you to have a full picture of the landscape. Sometimes it's just one decision maker, sometimes it's 5 in the Washington County case. But to start, before you have your research visits, definitely want to figure out what is the issue that you want to learn more about, what is the thing that you want to advocate for, and who is responsible. To be honest, sometimes it is not super easy. We have a very convoluted decision-making structure in our state and local governments and don't always know who is responsible for what. But when we think about the issues that we care about, we can do some initial research if we don't know right off the bat of who we should talk to. But through these research visits, you can also find other people to go talk to and leave with that final question of who else should we be talking to about this thing? You might find out, someone might tell you I'm not really responsible for that. They are over here. You might go then have a research visit with that person and they may say, we're not really responsible for that. They are over here. That doesn't typically happen. But you learn information not only about the issue, but who is responsible and what pieces are decided by whom. So with that, want to ask everyone here not to come off of mute, but in the chat before we start, and I may pull one of these as an example of an approach. What is an issue that you care about and that you want to advocate for? And to the extent that where does that advocacy happen? Is it the county? Is it an agency? Is it the governor? Is it the state legislature? So if you could put in the chat, issue that you care about, who that's responsible for making decisions. I may pull one of them for an example as we walk through this toolkit. And I'll be monitoring the chat while I also share my screen. One more time, issue you care about, decision maker, who decides on that issue that you know. I really love research visits. As we've named, it helps you glean information, helps you build relationships that you're going to want in the long term as you continue your advocacy effort. It doesn't necessarily mean that you are becoming friends with that decision maker. However, it does mean that you are building the rapport, the relationship, the familiarity, the legitimacy with the work that you're doing. And then also, again, gathering that information. The most important parts of a research visit are how you ground the group. So you got to find the people who are with you, who have an aligned self-interest in the thing that you want to advocate for or figure out if there does need to be an advocacy effort for. And then identify the decision makers that you want to have that meeting with. But it's also important that everyone is clear about how that meeting is going to go. You heard Sandra talk a little bit about how they invited people in and then they sat down with the team ahead of time to figure out what did we want that meeting to look like, what stories were we going to share to connect. All of that is incredibly important with the group that you go in with. Getting a clear and full understanding of what the decision maker and their office is responsible for as it relates to your advocacy area. So coming up with questions, doing the full scope of questions. What questions can we ask and then how can we ask follow-up questions to learn even more? And then gauge where they initially stand. You can do a light test about your advocacy effort. You can ask them a question. You can do some initial testing with your ideas and see how they react in that meeting. That is information to you to walk away with and then take back to them later down the line in your advocacy work. Okay, I said I would monitor the chat, and I'm seeing some responses coming in. Lots of stuff. This is great. Okay. I'm just going to read some of them out loud, but I'm sure folks can see the chat too. Women's reproductive rights, abortion specifically, and I would think state legislature or governor is responsible for overseeing this issue. That is true. And I think in research visits with some of them could learn who else should we maybe be talking to, what state agencies, et cetera. County and state health assessments having voter participation as a measured outcome, right? You named it, county, state, agencies, commissioners, anyone else? Yes. County and state health officers. Great. Access to healthcare, federal and state governments. It's a little harder to do research visits at the federal level with state senators and Congress people. Not impossible, but I find research visits to be very effective with state and local leaders. Building a low-cost gym for indoor recreation in Rochester Parks Department and county commissioners. Awesome. That's great. Divestment from fossil fuels, specifically from universities or state government. Probably be folks at the university and legislatures. Increase funding for anti-hunger and food justice programs. Awesome. This is all great. I will use one of these as an example as we go through the actual script and components of this meeting. So invitations. It is important to have other people in these visits with you. Typically, as you heard Martha and Sandra mention, it is a lot easier to get a visit if you do have constituents of the decision maker, or if you have an aligned interest with the decision maker. Say it is the county and state health officers. They probably want to hear from health professionals. So that is one, or a constituent, which is typically helpful in building that relationship with the decision maker. And note, it's not just a meeting to have a meeting. It is a meeting to build a path to take action on an issue that you care about. So as you make invitations to people, it is important to remind them of that. It is not just, another hour out of your busy schedule to go do this grounding and meet with this person. Who knows if they're going to take action. These are really important to build a foundation for the rest of the advocacy work. So naming who you're going to invite to the training, knowing that if you want to have the research visit, I don't know why it says training, invite to the research visit, knowing that if you put 15 people down, you might get 5 people there, but it's important to not just be alone. We have some invitation scripts here that you can use to send it to the decision maker to request a meeting. We have an invitation script here for you to invite others into this meeting with you. If you are a lone ranger heading into these research visits, how are you going to get more people with you? It's intentionally inviting them in. I won't go through these pieces, but they are here if you need them. Grounding ourselves, grounding in our personal stories, sharing that personal story. It's a way to build connection and relationship. Again, not to make them your friends, but to build a foundation to work from in the future with your advocacy effort. And then building out that agenda. You heard Sandra say that they together built the agenda for how they wanted to have the meeting run. It's incredibly important to do ahead of time and have everyone clear about that agenda. So as a facilitator, don't have to be on your own. You can be a co-facilitator. You can have other people leading this effort with you. But a pre-meeting is really important. This is where all the grounding happens. This is where the agenda gets set. This is where people are clear about their roles going into the meeting, getting aligned about how we want that meeting to go and what kind of questions we're asking. The italicized text here is a script from a toolkit I put together on these county research visits. So the example here is asking county officials, county commissioners about democracy explicitly. In the meeting itself, you're gonna want to do introductions of everyone in the room. You're gonna want to talk about your purpose for being there. You heard about some commissioners that maybe were a little guarded. It's important to share not too much, but just enough about what your goals of the conversation are and the purpose of you sitting down with them to hopefully help open up a bit and have an authentic conversation and what you want to get out of the meeting. It, again, you don't need to give them the full detailed field plan of your advocacy effort, but what you're hoping to accomplish. We're hoping to learn more information about this or build a relationship with you to continue the conversation about access to healthcare. Then comes the information gathering. This is the bulk of the conversation. It's an open conversation. It doesn't have to be like an interview. However, you did request a research visit, so they are clear that there's going to be some questions being asked. Getting really clear about what those questions are for your issue. Here are some examples of what they could be. Asking about the scope of the office, asking about how they relate to other roles. What do you feel like is working particularly well is another good question in this issue I care about. What do you hope would change, just to kind of flesh out how they feel about it to start? How do you feel about, and then maybe light touch your advocacy effort. How do you feel about building a low-cost gym for indoor recreation in Rochester? How could we make that possible? What could that look like? What else can we do? If you're not satisfied with the response, ask what else. And if they get creative, about some other options, and then always asking about next steps, any next steps, any next people that they would recommend talking to, any other departments or decision makers they would recommend checking in with. And also make sure to assign a note taker role so that you have all that information as you leave, because that is a really key piece of building out the ongoing advocacy effort after this research visit. Again, thank them at the end for their time. That's important. People like to, feel good about the conversation they had and that their time was valued and respected. So that's a key piece. But then two, again, asking if there's anyone else they should be connecting with after the research visit, and opening the door for, we want to remain in touch and we want to continue the conversation. Following up with thank you notes, as Sandra mentioned, is a great idea. It can be an email, it can be a handwritten card, can be anything to continue leaving the door open and being persistent about continuing the relationship and building together. And then debriefing with your group, really important to gauge, both as the pre-meeting was to ground before you go into the research visit, the debrief to gauge how people felt about the research visit. Are there questions we wish we would have asked? Can we follow up with them in an email? What is the next step coming out of this? You don't have to figure out everything in this debrief. It doesn't have to be a full, now here's our advocacy plan, knowing what we know. But it is important to have that conversation to figure out what are the next steps to build out that advocacy plan. Who else do we need to go meet with to then build out our full plan of action? And then also too, if you have a research visit and say there is an organizing path or a strategy coming out of that research visit to take more action on your effort, make sure you follow up with the people that were there so that they keep engaged and keep part of the effort to make the change that you all came together to research with these folks and ask questions about. It's important to not just let it go and fizzle out and again have a meeting for the sake of having a meeting and learning more information. It is to help you be the architect of building out that advocacy effort. And you want to make sure that the others who are there with you continue to be part of that so that you can do it together. It is, from experience, not fun and not effective to do advocacy work on your own. And so making sure that the folks in the debrief, get everything off their chest that they need to say about the meeting and are clear about next steps, but then making sure to follow up with them on those next steps to keep the ball rolling and moving forward on your advocacy effort. So with that, I think I will wrap it up and leave time for questions unless I'm turning it to anyone else.
Thanks, Lily. We will jump into questions, and I have two that I can kind of start us off on, and if others want to put their questions in the chat. So one of these came in the chat, and Lee asks, in advance of the meeting, how do we find any testimony that the politician or policymaker has offered publicly so we fully understand their viewpoint. I did provide a partial response that is part of what the research visit is for, but if you do want to know a little bit going in, so you're not flying blind, how can you do that?
Yeah, that is a great question. It depends on your advocacy effort. So there are some organizations that keep a track record of how folks vote, particularly for the legislature or the governor. That's a little bit more public. So if it is reproductive freedom, for example, there might be, and I can't name any off the top of my head, but they keep kind of like scorecards of vote history, or quotes or testimony offered. So that's an option. At the Minnesota legislature, they have voting records for all of the legislators. So you can go onto the Minnesota legislature website. I can search it in a minute and find where you can find the vote record. But you can go in and see what they've voted yes and no on in the past. Most meetings are public meetings, which means you can either go to the meeting in person or they're recorded. Like the county boards, for example, they all have different websites, but they have agendas that have meeting minutes and say what was said. They have recordings of past meetings. So if you know your issue was on the agenda and you want to see what they said, you can go back to the date that they had that meeting and watch the recording. You can look at their social media and see what they've said about an issue. And I mean, there are many other ways, but I think that those are the primary ways, and they range for every different decision maker or elected body. So in these research visits, if you do want to go in ahead of time, you can do a little bit of that background, but they are really meant to help you flesh some of that out in the conversation too.
Awesome, thank you. And I know you've been saying this along the way by walking us through the research visits, but just because we do have MPHA has a like legislative visit training coming up, and then We Choose Us has our lobby day coming up. Can you just say really kind of a summary of like the difference between a research visit and a lobby visit for folks?
Yes, definitely. So a research visit is a lot more information gathering and relationship building. Legislative visits can be a little bit of information gathering and a little bit of relationship building too. But research visits are a longer period of time with usually a bit of a smaller group of people that allow you to really dig into the questions and not come in with a pre-established agenda, but to really build out that landscape, gather the information, figure out how to move forward. And it usually happens a little bit earlier on in the advocacy effort too. If you're unsure about where to even start, you can start with research visits. Legislative visits are typically when you have a baked agenda item, maybe there's a bill number attached, and you will go to your legislator advocating for that thing. You usually have some talking points in front of you. It's a pretty clear advocacy effort that is already baked, that is already established. And those meetings are a lot shorter. Usually for legislative visits, they offer about 15 minutes, and it's a couple people get to tell their stories. It's definitely usually is constituents. And then the meeting is over and it's you telling them you want them to take action on your item. Less information gathering, less room to ask questions, and a little less early in the planning for your advocacy.
Awesome, thank you. I do want to invite folks to put questions in the chat, but in the meantime, I'd like to ask Sandra and Martha to come back to you. Can you say a little bit, did you have subsequent visits with your commissioners? I mean, we've talked about research visits as getting information, but then also building relationships. So if you could say maybe just a couple minutes on what relationship building looked like in Washington County on this issue and kind of where it went after one of those first visits. And then we'll keep looking for questions in the chat and then wrap up.
Well,
Martha, why don't you take it?
Okay, we're at the stage with the Washington County Democracy team where we've done these visits and we're now like, oh, so now what? And the answer to that now what is a couple of things that I think relate to the question you asked. One is we have committed to ourselves to have several people attend some of the Washington County Commissioner meetings. And so just to go and watch, and there we are. hi, here we are, we're paying attention, we're coming to see what's up and that sort of thing. And the other thing that we have said to ourselves is that as this election gets going later on in the year, that we want to follow up with these election officials. And since we were invited once for the November elections, which in Washington County, what there were school board elections. So we'd like now for, if there's a primary and if there will be elections in November, we would like to be a part of that process of just watching it happen. And so we intend to follow up with those election officials, and they have, I mean, all of this is open. They encourage people to come, and we're just going to be part of the people that come, because we want to be able to say, if there's misinformation out there, yeah, we were there, it's all right.
Awesome, thank you. Again, want to encourage folks to put questions, even if it's like, hey, I want to do this on this specific thing. Can you say a few words about that? Or just, this is now your time to get some awesome tips and tricks, as we always say, from folks in real time. But okay, so let's see. The phrase, so Lucy says, thank you for the great advocacy info. The phrase research visit is new to me in the context of advocacy. Is this language elected officials and staff and aides recognize when scheduling meetings? I'll let both Nora and Lily mention that, but I will just say, as both a nurse and a public healther, that yes, and we even in discussing this training said like, oh, what language should we use? Because research visits is language we're accustomed to in organizing and advocacy, but bringing that language to either scientists or health professionals, it has a really different feeling. And we sort of decided to thread the needle. We enticed everyone in with advocacy dialogues in the title, but then we also are giving the language that is used in those spaces. So I'll let Lily and Nora say a little bit more about that, but it's a great question, Lucy. Thank you.
Nora, do you want to take it first?
You go first.
Okay. Yes. So research visit, I think, is in the organizing world, which often uses a lot of jargon and is, you know, loaded because it is organizing. The purpose of it is to connect with real people and organize amongst real people. And if you use language that people don't understand, you know, it becomes a whole. So research visit is a new term for a lot of folks, including myself, before I started organizing. It is a term that elected or decision makers, appointed decision makers do understand if you add a couple words after it, like research visit, to better understand. And I think that feels pretty clear to them. Nora, anything to add about that?
No, thanks, Lily. Great summary.
I just like to add, this is Jean Ayers. I would like to add that a research visit isn't just one way. The other benefit of a research visit is you're strengthening your team's understanding, your relationship in the team, your leadership skills within the team, and in relationship to elected officials or policymakers. So it's it's bi-directional. And I just think that that's different than a legislative visit and you're one person in 20 and you get to do some testimony and you go home. That's an important space and role. But when you go as a team, like Sandra and Martha shared, the team went to coffee, they had the pastry, you know, but you're getting a relationship, and together you're holding yourselves and electeds accountable. So that's a really important difference when you're thinking about building your collective power and influence in a space.
Thank you, Jean. We have 2 more questions in the chat, and I do want to leave time to be able to tell people how they can get involved more. But the first one from Abby, she has some, or they have some, sorry to assume, funding to do an op-ed project, and where might op-eds fit into this process? Well, I'll just leave it at that.
Yeah, that's a great question. Also, Nora, feel free to weigh in. I think op-eds, as I think about research visits, as Jean so aptly named, it is both a way to grow your team and also to be the architect of setting the full advocacy plan and building these relationships and information gathering, et cetera. Op-eds could come as a result of some of those research visits. If your sort of point of advocacy and opinions have been refined and shaped, placing opinion articles is a great way. You could even do it as a team. I found that typically they allow up to 3 co-authors, but some people who have gone to those research visits and had conversations and have a more refined opinion about the issue at hand, those could come then. They could also come a little bit later as you're trying to get more earned media and build awareness, as you've established sort of what the advocacy path is as well. I wouldn't maybe expose your entire meeting and research visit with said elected official in an op-ed, but it could help as a tool to refine that opinion in a way that someone might want to write about and publish.
Awesome. See, Nancy asked, when you asked if there are other decision makers involved in the research issue, do you visit them? If yes, do you keep visiting until you are just hearing the same names over and over? So you get sent on down the line or across, whatever.
I would visit them. I think that, you know, if you have a full understanding of who is responsible for that issue, like it is clear in Sandra and Martha's case with the Washington County team, county commissioners hold most of the responsibility for elections. So once all 5 of them were met with and had a clear understanding about all 5, then yes. I think if you go to the state level, and let me back up, and in those 5, they say meet with the elections official because they are also responsible, would definitely go do that. And maybe ask the elections official if there's another person, but I think that is a pretty full scope of the responsibility at the county level. You could go to the legislature and have one senator say, go talk to this other senator and this other one and this other one, and there's a million of them. Not really, but 67, 8. Yikes. There's a lot in Minnesota. It depends on what state you're in too. But I think that in that case, I wouldn't go to all of them. They could point fingers in all sorts of directions. At a certain point, you have to discern, like, okay, we've had 5, 6, 7. I think we've got the information we need to move forward. It's not a requirement that you talk to every single person.
Yeah, and I think I would add again, from the health perspective, and especially in public health, we sometimes fall into analysis paralysis. And not only are you hearing the same names again, but are you, as Sandra and Martha talked about, you're hearing the information, you're debriefing. What did we learn? How does it affect our strategy? What does it change? And and you're still, as Lily has said, the architect or in control of that process. So you're actively taking in that information, determining how it's most useful for your interests and like what you do need to know, and, oh, do we need to know more about this? And so taking that into account in your process and sort of figuring, you know, along the way, being like, okay, I think we're good, or maybe we need more, but we also need to do this. And it's a continuous process, I think, is part of that active. So we just have a few minutes left. I want to let Lily, because we have a question from Nancy about the legislative agenda for We Choose Us for 2024, which is great. And I want to, though, put a couple of plugs in. So we talked a little bit about what we've been doing in the past year for the public health community and MPHA and HDHP specifically, with other partners, Advocates for Better Health, and Minnesota Society of Public Health Educators. We have a few ways that we'd like to invite you all to engage more on this particular issue. There is the We Will Vote initiative, which Nora will put in the chat, and that is to really mobilize ourselves and make those personal commitments and organizational commitments to support voting in our workplaces, whether it's our hospital, our nonprofit, our community organization, et cetera. So you can learn, we're going to have some spaces where you can learn a little bit more about that. We also have we are going to be looking at how to use tools like research visits to advance spaces like community health assessments for where voting and civic health indicators can be brought in and strengthen those relationships and the reflection of that in our data on our communities. And then also to join for the We Choose Us Lobby Day is coming up at the end of the month, February 29th. I'll let Lily say more, but that is going to be a great day to put into practice another advocacy skill of legislative visits. So those two, the We Will Vote initiative and the lobby day specifically, I am inviting you all to join that. And then the way to do that with our MPHA, ABH, and MinSophie group is to join our Tuesday Minnesota Voting and Health meetings. And I'll be sharing that information too, and my contact information to join that. So Lily, you want to say a little bit about the year ahead for We Choose Us?
Sure. So as far as legislative priorities go, I will drop in the chat our website that has just been updated. At that strategy retreat we had, we ratified our core agenda with grassroots leaders and our partners. And the things that have really risen to the top. So we are a voter access, voting rights, pro-democracy campaign, and we know that there are other things that fall under the democracy umbrella and make sure that we have a thriving, healthy democracy. And one of the things that has really come to the top is this conversation about money in politics, and how money is wielded in the electoral arena to keep people's voices out and often cause cynicism, frustration, et cetera, with the political process. So in that vein, we are really focused on building out our public financing program through a small donor match, which I could talk about for hours and I won't, but it's on our website, a couple more details about what that would actually mean, but it's empowering small donors over corporations and wealthy special interests in who gives in our elections and who controls the power through donations. And then also a state voting rights act, as we've seen some really horrible decisions come from both the federal Supreme Court and the 8th Circuit Court of Appeals that really strips away voting rights from voters of color to advocate on their behalf if they're facing voter suppression tactics or vote dilution tactics. So we want to pass to restore some of those rights in Minnesota. Those are two big ones on our core agenda. Also, more polling locations on college campuses and accessible ballot drop boxes for people who are going to be voting absentee, along with some other priorities that our partners are working on. So all of that can be found on our website, and those are the things that we will be advocating for at the Capitol on February 29th. I will grab our link to register for that, but those are going to be legislative visits. So those are like the 15-minute conversations with legislators, still a great building opportunity for relationships and ongoing advocacy. But we'll also hear from some of our bill authors and champions in a sort of rally speech style before we kick off those legislative visits. So that's what the 29th is about, and would love to see some folks there.
And having gone last year with my kindergartner and my mother, who is usually on the other side of the political conversation for me, I can say it's energizing, it's supported, there's training, it's so well organized, it's great. So please join. I did put the link in for the registration there and noted that our MPHA voting and health team will be putting some things together. So just want to take the last few moments to thank Sandra and Martha from Washington County's Democracy team, Lily from We Choose Us, and Nora, and all of you for joining us today. We'll share out the resources, the recording, and we'll be following up to hopefully engage you on these topics more. Thank you.
Thanks, everyone.
Oh, thank you, Mary. Please note the 4-question evaluation, and that's in the chat, and we'll send that out in the email as well. I appreciate it. Thank you.